Hello, sir.
Hello, good morning, madam.
Hello, sir. Good morning.
Good morning. So today you are going to speak about infection, madam.
Yes, sir. Correct. Infection.
Okay.
Shall we begin?
Yeah, madam, please.
Hello, everyone. Welcome to Tawhid Foundation for Allied Healthcare Sciences, Bangalore. So I'm delighted to guide you through this important presentation on infection and its management, designed specially for BSc MLT first year students. So today's topic is, oh, sorry, I opened different this.
Yeah.
1 second, sir.
No issue. You can edit
This
it. No issue.
topic is infection. So, infection is a fundamental concept in healthcare and understanding. It is essential for every medical and allied health professionals. So, infection refers to the entry and multiplication of harmful microorganisms such as viruses, bacteria, fungi, parasites, and prions into the body, which can disrupt normal body functions and lead to diseases. It is crucial to study infections because they can be life threatening, spread quickly in communities and hospitals, and pose a risk not just to patients but also to healthcare workers. So, for instance, a common cold is a mild infection, while diseases like tuberculosis or hospital acquired infections can be severe and challenging to control. Normal flora. Our bodies harbor two types of microorganisms. First is resident flora, second is transient flora. So, resident flora are usually harmless and play beneficial roles like aiding digestion. Transient flora comes from our environment and can become harmful, especially if our immune system is compromised or if barriers like skin are broken. Infectious process. The process of infection starts when pathogens invade the body. They multiply inside, produce toxins, and cause damage to tissues. This is what ultimately leads to symptoms and diseases. Definition of infection. An infection is specifically defined as the invasion and multiplication of disease causing organisms in the body. These can be viruses, bacteria, uh, fungi, parasites, and prions. So these viruses can be like flu, bacteria like pneumonia, fungi like candidiasis, parasites like malaria, or even prions as seen in some neurological diseases. So types of infection. There are 6 types of infections: primary infection, secondary infection, localized infection versus systematic infection, clinical versus subclinical infection, opportunistic infection, cross infection and reinfection, and last is focal infection. So we'll start with primary infection. Primary infection, the initial infection by a pathogen, example primary tuberculosis. Secondary infection, an infection by a new pathogen during the course of a primary infection, example bacterial pneumonia following viral influenza. Localized versus systematic infection. Localized infection is restricted to one site, like a cut infected by a bacteria. Systemic infection spreads throughout the body, for example, sepsis. Clinical infection shows observable signs and symptoms. Subclinical infections, no visible symptoms but organism is present. Opportunistic infection occurs in immunocompromised individuals like fungal infection in HIV patient. Cross infection, these cross infection acquired from another person which is infected. Reinfection, getting infected again by the same organism after recovery. Focal infection, it is a local infection with potential to spread or cause effects elsewhere. So this is an example of cross infection. Here three persons patients are seen in this diagrammatic representation. So the middle person is getting cross infected by the other two patients which are already infected. Sources of infection. There are two main sources of infection. First is endogenous and exogenous. Endogenous originating from the body's own flora, for example, gut bacteria causing urinary tract infection. Exogenous from outside the body, other people, animals, the soil, or the environment. Routes of spread. So there are five routes of spreading infection. First, pathogens enter via various routes. So we'll start with respiratory tract, example tuberculosis and influenza. Alimentary tract, for example cholera and dysentery. Skin and mucous membrane, example staphylococcal infections from wound. Genital tract, example syphilis and HIV. Placenta, example rubella virus, toxoplasma, transmission from mother to fetus. Common pathogens and examples respiratory, alimentary, genital, placental. So, respiratory, Staphylococcus pneumonia and influenza virus, alimentary, cholera, dysentery, genital, syphilis, gonorrhea, placental, toxoplasma, rubella virus. Signs and symptoms. Typical indicators of infections include redness, swelling, tenderness at the site, drainage, which is pus, fever, fatigue, and nausea. These help guide healthcare workers toward diagnosis. Chain of infection. The spread of infection follows a chain: pathogen to reservoir to portal of exit, mode of transmission, then portal of entry, and susceptible host. I'll explain each terms in brief. So, typical diagram structure of chain of infection. A series of six interconnected links, often drawn as a chain, representing each stage in the infection cycle. So, first is infectious agent, which is pathogen. This link often features illustrates of bacteria, fungi, viruses, protozoa, and helminthes. These the microorganism that causes disease such as Streptococcus pneumonia or influenza virus. Reservoir, human figures, animals, water, or objects. These are the locations where pathogens live and multiply before infecting others. For example, the human body, contaminated soil, or medical equipment. Third is portal of exit. So, arrows leaving the body via nose, mouth, wounds, urine, feces. Here, how pathogens leave the reservoir. Sorry, this portal of exit create excretions, secretions, droplet, and skin contact. So, here human figures, these are locations where pathogens live and multiply before infecting others. Example, the human body, contaminated soil, or medical equipment. Means of transmission, which is mode of transmission: bloodborne, airborne, droplet, common vehicle, and vector-borne. So here, hands, droplets, dirty instrument, insects. It is a path taken by the pathogen from one host to another, which is direct, indirect contact, droplets, airborne, and vector-borne. Portal of entry. So here, broken skin, mucous membrane, gastrointestinal tract, respiratory tract, and urinary tract. Here, how pathogens enter the reservoir to move a new host. For example, when someone coughs, the exit portal is in the mouth. Last is susceptible host. Neonates, diabetes, immunosuppression, cardiopulmonary disease, elderly. It is a susceptible host which transfers infections to healthy individuals. Pathogenic microorganisms. So pathogens include bacteria, viruses, fungi, fungi, parasites, and prions. Their harmfulness depends on factors like virulence, which is severity, invasiveness, ability to spread, and pathogenicity, ability to cause disease. So this diagrammatic representation is the key characteristics of pathogenic microorganisms that determine their ability to cause infection and disease. So we'll start with pathogenicity. Pathogenicity is the ability of microorganism to cause disease. These characteristic reflects whether an organism can evade the host successfully and produce diseases. A pathogen must have certain traits to infect and cause illness. Virulence, the degree of severity of disease caused by a microorganism. Virulence indicates how aggressive or harmful the disease will be. High virulence means the pathogen causes severe illness, while low virulence result in mild symptoms. Third is infectious dose, the number of organisms required to initiate or infection. Some pathogens need only a few organisms to cause disease, while other needs a larger number. The lower the infectious dose, the easier it is for the pathogen to establish infection. Fourth is toxigenicity. So the ability of organism to produce injurious substances, that is toxin, that can damage the host. So many bacteria and other pathogens produce toxin that directly harm tissues or disrupt normal body functions, which indirectly contributing greatly to disease symptoms. Adaptability, the adaptability of microorganism to adjust to changing conditions. This includes the capacity of pathogen to survive hostile environment, evade the host immune defenses, or develop resistance to antimicrobial drugs, which makes treatment very difficult. So each of these characteristics contributes to the pathogenic potential of a microorganisms. Pathogenicity determines if a microorganism can cause disease. Virulence influences how severe the diseases will be. Infectious dose impacts how easily infection can be established. Toxigenicity relates to the damage caused by toxins. Last is adaptability, affects survival under changing conditions and resistance development. So understanding these factors helps in developing strategies for infection control, antibiotic use, and treatment planning. Reservoir of portal of exit. So reservoirs where pathogens live and multiply, people, animals, the environments, or even inanimate objects. Portal of exit, how they leave the host through secretions like saliva, stool, urine, blood, or fluids from skin lesions. Modes of transmission, there are several ways infections can spread. Contact, direct like touching, or indirect through contaminated objects. Droplets via coughing or sneezing. Third is airborne, tiny particles that stay suspended in air. Vector-borne, spread by insects like mosquitoes. So, portal of modes of transmission, I'll explain each terms. Mode of transmission is the mean by which an organism transfers from one carrier to another, either by direct transmission or indirect transmission. Second is contact transmission, direct transmission, or indirect contaminated transmission. So contaminated transmission is the most common route of transmission of organisms in healthcare settings. Droplet transmission, droplets should come in contact with mucous membrane directly or indirectly through sneezing, coughing, talking, etc. Examples of droplet transmission include influenza and meningitis, etc. Airborne transmission, there are three common diseases that are transmitted through the airborne route: chickenpox, varicella, tuberculosis, and measles. Vector transmission. Vector transmission occurs when an insect or animal transmit diseases to humans. Best example is malaria and dengue fever. So, portal of entry. Portal of entry can be via mucous membrane, wounds, catheters, and feeding tubes. These pathogen enters the body through all these membranes, wounds, and catheters, feeding tubes. Susceptibility host. Certain groups are more at risk. First is elderly, which is low immunocompromised patients, infants, immunocompromised, and malnourished. All these patients can be a susceptible host. Breaking the infection cycle. Prevention strategies include cleaning, disinfection, sterilization, controlling reservoirs, blocking portals of exit and entry, and protecting vulnerable individuals. Course of infection. Incubation, prodromal illness, convalescence. So we'll start with incubation. Incubation, the period after exposure but before symptoms appear. Prodromal, early general symptoms like malaise or low fever. Illness period, full development of disease, specific symptoms, pathogen count is highest. Convalescence, recovery phase as immune response clears the infection in this phase. Defenses against infection. The body is occupied with barriers and immune response, in which skin, a solid wall keeping pathogens out, phagocytes, Pac-Man like cells engulfing bacteria or viruses, normal flora, it is an outcompete pathogens, antibodies and antitoxins. So antibodies, Y-shaped molecules neutralizing pathogens, lymphatic system, which is a network of vessels and nodes filtering pathogens. Asepsis. So, asepsis versus surgical asepsis. Here, medical routine hand washing, gloves, cleaning surfaces of healthcare workers, washing, all this will come in medical sepsis. Surgical, sterile gloves, mask, surgical fill, all this will come in OT setup with sterile zone. So, two things we can also include here in asepsis, which is sharp disposal in a container with a warning symbol. Needles and all sharp materials will be dropped inside. Spill management. Staff member in gloves using disinfectants on a spill marked on the floor. So nosocomial, which is a hospital acquired infection, these occurs in healthcare settings often due to catheters and surgery, improper sterilization. Common sites include urinary tract infection, respiratory tract infection, wound infection, and bloodstream infection. Iatrogenic infections, it is here, these are caused by medical procedures which is not handled properly. Prevention in healthcare. So, best practices include hand hygiene, isolation precaution, standard and transmission based. Third is universal precaution, use of gloves, masks, and protective clothing. Handling and disposal. So, safe procedures for handling and disposal. Sharp needles disposal, contaminated linen and waste management. Here, managing contaminated linen and waste are important. Cleaning spill with disinfectant, for example, Dettol, ethanol, etc. Special precaution, these aim to prevent ventilator associated pneumonia, catheter associated urinary tract infection, UTIs, surgical wound infections, and sepsis. So, guidelines for healthcare workers. So it should, for all public health workers, maintain personal hygiene and wear clean uniform, keep nails short, avoid rings and all, because wearing gloves it will be difficult, so we should not wear any accessories. Disinfect stethoscopes regularly, remove work clothes after duty. like PP or lab coat. Antimicrobial sensitivity testing AST. So, antimicrobial sensitivity testing is a crucial laboratory procedure that helps determine how effective specific antimicrobial agents are, such as antibiotics, antifungal drugs, are against particular microorganisms like bacteria or fungi. So, when a patient has an infection, doctors need to know which antimicrobial drug will effectively kill or inhibit the microorganism causing the illness. The AST procedure involves isolating the microorganisms from the patient samples such as blood, urine, or wound swabs and testing it against various antimicrobial agents in the lab. These testings reveal whether the microorganism is sensitive, which is susceptible to certain drugs, meaning the drug can effectively treat the infection. Alternatively, if the microorganism is resistant, the drug will not be effective and the healthcare provider must choose a different treatment. So, AST guides clinicians in selecting the right medication, dosage, and duration to ensure successful treatment, minimize side effects, and prevent the development of drug resistance. So, in total, sensitivity testing is vital for personalized, targeted treatment of infections, improving patient outcomes, and slowing the spread of resistant microbes. Its purpose is to select the most effective drug for treatment, to monitor emerging resistant patterns, to assist in outbreak control in hospital. So first, why it is important, AST helps determine which antibiotic or antifungal agents will successively inhibit or kill the infecting microorganism. As well as by identifying the best drug, treatment can be tailored specifically for the patient's infection, leading to faster recovery and improved outcomes. It also prevents the use of infecting drugs, avoiding unnecessary side effects and treatment failures. Second is to monitor emerging resistant patterns. Here, regular AST helps detect changes in microbial susceptibility over time. It identifies new or increasing resistance to antibiotics, which is crucial for tracking in antimicrobial resistance, as well as this allows healthcare providers and hospitals to update their antibiotic policies and choose treatment that are still effective against resistant strains. Third, to assist in outbreak control in hospitals. So here, when infections spread rapidly within a hospital outbreak, AST helps identify the resistant pathogen involved. It guides infections control team in selecting appropriate AST therapy and implementing measures to stop transmission. Helps in containing outbreak caused by multi-drug resistant organisms, as well as adapting treatment protocols and hygiene practices accordingly. So, in total, AST is critical for personalized patient care, combating antibiotic resistance, and maintaining effective infection control in healthcare environments. Common methods used in AST to determine the effectiveness of antibiotics against bacteria. So first is disk diffusion method, which is by Kirby-Beer test. So in this classic method, paper discs impregnated with specific antibiotics are placed on the surface of an agar plate that has been uniformly inoculated with the bacterium being tested. The plate is incubated for 18 to 24 hours, allowing the bacteria to grow. If the bacteria are sensitive to the antibiotic, a clear zone around the inhibition appears around the disk where bacterial growth is prevented. So, the diameter of this zone is measured and compared with standard charts to classify the bacterium as either sensitive, intermediate, or resistant. So, sensitive, which is S, antibiotic inhibits bacterial growth effectively. Intermediate, antibiotic effect is moderate, may require higher doses or combination therapy. Third is resistant, antibiotic does not inhibit growth, not effective for treatment. Second is broth dilution method. This method is used to determine the minimum inhibitory concentration, MIC, which is the lowest concentration of an antibiotic that prevents visible growth of organisms. The bacterium is exposed to varying concentration of antibiotics in liquid medium broth. After incubation, the MIC is identified by observing the lowest antibiotic concentration where no growth occurs. So this provides precise quantitative data about bacterial susceptibility. E-test, which is epsilometer test, the e-test combines the simplicity of test diffusion with quantitative MIC determination. It uses a plastic stripe impregnated with a gradient of antibiotic concentrations. The stripe is placed on an inoculated agar plate. After incubation, an elliptical zone of inhibition forms and the MIC is read where the ellipse intersects the stripes. So this method is user friendly and gives direct MIC values. Fourth is automated system. So modern laboratory often use systems like Vitek, Microscan or Phoenix machines. These automated instruments perform rapid identification of bacteria and susceptibility testing with minimal manual interventions. They provide results faster, often within hours, which improves timely patient treatment decisions. So these systems use a variety of biochemical tests and optical readings to assess microbial growth and resistance. So in total, this diffusion is a simple and widely used method to assess antibiotic effectiveness qualitatively. Broad dilution and e-test, these two tests provides precise MIC values essential for detailed antimicrobial therapy choices, and automated system, these increases speed and efficacy in clinical microbiology labs, which enhance patient care through timely data. So together these methods help clinicians choose the most appropriate antibiotic for treating infection effectively. Clinical importance helps in prescribing narrow spectrum antibiotic reducing resistance. EST identifies the specific antibiotics which is effective against the infecting microorganisms. This enables doctors to prescribe narrow spectrum antibiotic. These target only the causative pathogen, which is rather than broad spectrum drugs that affect many bacteria. So hence targeted therapy slows down the development and spread of resistant bacteria. Second, it detects multi-drug resistant MDR, extensively drug resistant XDR, and pan-drug resistant PDR strains. So AST can identify microorganisms that are resistant to multi-drug resistant classes, nearly all available antibiotics XDR, or virtually all agents PDR. Early detection of this resistant strain is crucial for managing difficult infections and adjusting treatment plans to effective alternatives. It helps healthcare providers be alert to the presence of highly resistant pathogens, which require special contaminant and treatment strategies. Guides infection control measures. So, knowing the resistance of patterns of pathogens allows hospitals and healthcare facilities to implement appropriate infection control protocol. For example, patients infected with MDR organisms may be isolated to prevent transmission to others. EST result in outbreak investigations and contaminant by recommending specific hygienes, sterilization, or isolation measures to stop the spread of resistant bacteria. So, in summary, antimicrobial sensitivity testing is essential not only for effective treatment but also as a cornerstone in controlling antibiotic resistance and safeguarding public health within healthcare settings. Conclusion: infection control is contagious and multi-step process. The critical goal is breaking the chain of infection to prevent disease spread and protect patients and healthcare professionals alike. AST antimicrobial sensitivity testing is an essential laboratory tool that guides the effective treatment of infections by identifying the most appropriate antimicrobial agents. It plays a crucial role in combating antibiotic resistance by promoting the use of targeted narrow spectrum antibiotics, detecting resistant of strains, and aiding infection control measures in healthcare settings. So, through timely and accurate EST, healthcare providers can improve patients' outcome, reduce the spread of resistant microorganisms, and ensures rational use of antimicrobials for better public health management. Questions? So, I have listed 6 questions for 3 marks. First is define infection. So you can define here infection is invasive and multiplication of disease causing microorganism. It includes bacteria, viruses, fungi, protozoa, and prions into the body. You can give suitable example for that. Name 4 types of infections with examples. So basically 4 types of infections are primary infection, secondary infection, localized infection, and systemic infection. You can give description of each infection with examples. List 3 modes of transmission of infection. Modes of transmission, which is contact transmission, droplet transmission, or airborne transmission. You can give description and purpose of this 3 modes of transmission with examples. Define hospital acquired infection. Hospital acquired infection, also known as nosocomial infection. You can give explanation what it is exactly and why it is important. Name 3 causative agents of hospital acquired infection. 3 causative agents, basics are Staphylococcus aureus, E. coli, and Pseudomonas aeruginosa are the 3 most common causative agents of hospital acquired infection. Write 2 methods of antimicrobial sensitivity testing. Either you can mention diffusion method by Kirby-Beer or broth dilution method MIC test here. 5 mark questions. So 5 mark question, explain different modes of transmission of infection with example. Different modes: contact transmission, droplet transmission, airborne transmission, and vector-borne transmission. With suitable example, you can elaborate in detail. Discuss prophylactic measures for hospital acquired infections. So here all the basic hygienes which is required to avoid infections, such as hand hygiene, use of personal protective PP kit, lab coat, isolation practices, safe invasive procedures, education and training. All these disinfectants can be mentioned here. Um, um, Third is Third is describe the diffusion method of antimicrobial sensitivity testing. So Kirby-Beer method in detail, its procedure and zone. You can measure the diameter and guide appropriate antibiotic therapy. Write a note on types of infection with suitable examples. Same for 3 mark question I mentioned, but here you elaborate in detail all the types: primary, secondary, localized, systemic, opportunistic, cross infection, focal infection. All this you can mention here. Last is explain the importance of AST in hospital setting. So why it is important in hospital setting? It ensures effective treatment, prevent antibiotic resistance, guides infection control, improves patient outcomes, monitor resistant trends, and it is cost effective also. So all these 5 mark questions are important. Thank you, sir.
Yeah, very nice explanation, madam. Very nice
Uh,
class, Alhamdulillah.
Thank
So
you, sir.
today we have
Yes,
discussed about infection,
yes, sir.
but the slide starting, I think we need to change it.
Yeah, I forget to change this title.
See,
Uh,
no issue, no. We can next time we can correct it.
yes, sir. I'll make sure not
Yeah, yeah.
to do this
So
mistake.
because the students may think that this is
Yeah,
related to
correct,
biomedical
sir.
waste management.
Yes, sir.
Infection is a separate topic actually.
Yes, sir.
And coming to, you explained about very nicely about this one, madam, hospital acquired infections, HIC.
Yes, sir.
And I feel so,
Hmm.
technical staff of laboratory can play a
Yes.
major role in
Yes, sir. Technical
antibiotic
staff.
selection.
Yes,
Okay.
yes, sir.
And as well as he can be a part of infection control team
Team
and antibiotic policy making team.
policy.
So
Mm-hmm.
even in NABH, National Accreditation Board of
Mm-hmm.
Hospitals,
Yes,
so
yes.
there is a separate chapter for infection control. So
Correct,
we
sir.
call it as a IPC, Infection Prevention and Control.
Control.
Mainly, it will be having around 8 standards.
Mm-hmm.
So majorly, it covers about hand hygiene, biomedical
Hand
waste
hygiene.
management,
Basic hygiene procedure.
and that is hospital acquired infections. And there are a lot of things like VAP and CLAPSI, COTI,
Mm-hmm.
those things, SSI, even surgical
Mm-hmm.
site infection,
Mm-hmm.
those things they are going to capture, and they can be produced as a KPIs, key performance indicators under HIC.
HIC.
Sorry, it is IPC. Now it is IPC. Before it was HIC. So
HIC.
I think a technical staff from a laboratory, so
Mm-hmm.
he plays a major role
Yes.
in detecting a correct antibiotic, yeah, selecting a correct antibiotic, and he
Correct.
supports to a clinician also.
Yes, sir.
And if something goes right, no, we can
Mm-hmm.
suggest to NABH also. So
Mm-hmm.
those who have done MSc MLT in microbiology,
MSM.
so they
Mm.
should be a part of infection control
Control.
team, and
Mm-hmm.
they can be a infection control officer. Yeah.
Yes, sir.
So I think right now they have not recognized it, I think so.
Mm-hmm.
Yeah, they are not realizing whether
Mm-hmm.
these MSc MLT medical microbiology
Mm-hmm.
candidates can be taken as infection control officer. Because I am dealing with NABH also. So in future,
Okay.
if there is a suggestion to the NABH,
Mm-hmm.
definitely we can suggest.
Suggest
Yeah,
this.
yeah.
Yes, sir.
Thank you, madam. Thank you so much. Very
Thank you
nicely
so
you
much,
have
sir.
presented the class today.
Thank you, sir.
Very nice discussion and very nice presentation. Thank you, madam. Thank
Thank
you.
you. Thank you, sir.
Shall
Thank
we
you.
wind up, madam?
Yes, sir. We can
Yeah,
write it.
thank you.
Thank you.